Hi, everyone. My name is Kate. I am a nurse educator here at Women's Health Network, and I am so excited that you're here to join our discussion about joint health. Joining me today in the discussion are our own health expert, clinical nutritionist and medical anthropologist specializing in bone health, Dr. Susan Brown. Hi, Susan.
Hello, hi, nice to see you all.
Hey, sorry about that gap for a second there. And also joining us is Dr. Mary James. She is a naturopath, and she's joining us from North Carolina. Hi, Mary.
Hi, everyone.
Thanks for being here. So, as I said, today we're talking about joint health. And just to clarify, I guess I feel like bone health and joint health kind of get lumped together sometimes and treated like one issue. What would you say are the considerations specific to joint health that we need to be aware of that maybe differentiate from bone health? Susan, what would you say about that?
Well, just to start in a very simple sense, bone really is certainly connected to joint. I mean, they're right together, and they're certainly part of a functional unit, the bone, the muscle, the joints. But when we think of bone health, we think issues of minerals, having enough minerals in the bone, and having enough healthy protein matrix. That's the sponge upon which the minerals sit. When we think of bone, we think of minerals, we think of the protein sponge. When we think of joints, we think of other issues like cartilage. There isn't mineralization in the joints. There's cartilage, another site of sort of protein tissue. So that's kind of an essential difference. You're talking about cartilage with the joints and the healthy cartilage or the wearing down of cartilage. And with the bone, you're talking about minerals and protein matrix. That's a simple way to distinguish them.
Okay. Mary, did you have anything you wanted to add on to that?
I guess I would just suggest that there are three important considerations for joint health. One being what is the health of the joint tissue, and there is some overlap there between, the cartilaginous ligaments, tendons, that type of collagen in the joint, and bone collagen. But like nutritionally, they often get supported by the same nutrients, and someone who's deficient in a number of those nutrients is often going to suffer in both the joint and in the bone density, the bone mineralization, like Susan was talking about. So that's one area, the tissue health. Another is the issue of inflammation. And if inflammation systemically is present, then any joint problem going on is almost always going to be exacerbated by that systemic inflammation. So rather than just treat an isolated joint that's in pain, other than an acute injury, often that can be very localized, but chronic joint pain especially should be treated systemically for inflammation. And then the third consideration I would have for joints is stressors on the joint, mechanical stressors. So that gets into alignment and postural balance, muscle strength, flexibility, that kind of thing, because the body is really one unit. All parts are connected, and so if you have imbalances, misalignments in some areas, that is inevitably going to have repercussions in other areas and often cause pain in areas that are not the original problem. So working with someone who knows about all those interconnections can be very helpful to get to the root cause.
Okay. And so it sounds like there are a lot of factors involved in isolating what the problem is when you're having any kind of joint pain or something like that. So very different from bone, but with some overlap. So
because, excuse me for 1 second, but in joint health, people often know because there's a pain, there's a symptom they can see, they can feel. Whereas in bone health, it's really more often a silent disorder. You don't feel anything really until you have a fracture.
Right. That's a really good point.
So if people will ask me, well, it's my back pain, do you think it could be a fracture? Or my hip, the pain I have in my hip, it could be, but most likely there's something to do with arthritis. That's an interesting area of overlap.
Yeah.
And distinction.
Okay. So everyone has experienced joint pain at some point. When should we start to be concerned, or when should we bring our joint pain to the doctor for an evaluation? Mary, when should we start to be concerned about the joint pain?
First of all, I would suggest that that's an individualized question, because even if it's something that's not an emergency, if someone is so worried about their pain, or if it's disrupting their sleep, if it's getting in the way, or they just want to know what it is, that's a good reason to go to the doctor, even if it's not, even if it turns out to not be something super important. Probably injury-related joint pain is going to be the main problem that will take people, or should take people, to the doctor. A lot of injuries will heal up on their own, but there are other injuries that have unrelenting, severe, sharp pain that hangs in there. There may be a deformity in the joint since the injury, and that's something to be concerned about. So go see someone. For non-injury joint pain, there still can be good reasons to get yourself to a doctor. Well, actually, let me say one more thing about injuries. One good reason to go to the doctor is that there might be a fracture in the bone in the joint. There might be a tear in a ligament or a tendon. And so that's a good thing to know about, especially if not going is going to make it heal up wrong. So back to non-injury pain. If you've got an autoimmune condition going on, like rheumatoid arthritis, which can lead to irreversible cartilage destruction, that's something you really want to get on top of as soon as you can. Hints or things to look for that might make you feel a little more inclined to, or might make you think about going to the doctor more, would be swelling, heat, pain in a joint, especially more than one joint, like in rheumatoid arthritis. It's often in up to 3 or more joints. It's often in the hands. It's often symmetrical. So if, an injury will often be just one side, one joint, but rheumatoid arthritis would be often mirror images of the joints in terms of what's hurting. With rheumatoid arthritis, there's often going to be pain in the morning, stiffness in the morning that takes a while to let up. Osteoarthritis, well, before I get to osteoarthritis, let me just quickly say there could be infection. So like Lyme disease can cause joint pain, but there's often other symptoms as well, like neurological symptoms, shooting pains, numbness, tingling in the extremities that would make you wonder what's going on, or there might be depression, or some psychological symptom, or a history of a bullseye rash, although not everyone notices that. Gout, it's usually the big toe. It usually follows some debauchery. Well, that's how the textbooks write it up. Drinking, eating a whole lot. Pardon?
I said a little indulgence.
A little indulgence, but often there's a predisposition to developing gout. But that's a good reason to get to the doctor if you've got a hot, red, swollen, painful big toe, because it goes along with systemic disease risks that are really important to get on top of. Osteoarthritis, I don't think is as urgent, especially if it's kind of mild. It may take place in an injury that had been injured at one point. Osteoarthritis is so common, especially in women. So 18% of women over the age of 60 have osteoarthritis. Many people don't know they have osteoarthritis. There's inflammation in the joint, there's wear and tear in the joint, and then as we begin to age and those tissues start to break down, it becomes more noticeable. And inflammation can really drive that, even though it's called a wear and tear kind of disorder. It's not just erosion or wear and tear. There are systemic factors that can contribute. So that's a good reason to work with someone, but it's not going to be as urgent, to get in there and see someone.
Okay. So lots of reasons that we might want to make sure that we're staying on top of our joint health. Susan, did you have anything you wanted to add to that about when you recommend having your joint pain looked into, or
Well, I think Mary's covered the medical issues. What we notice in the field of nutrition is many people will come in and say, you know, I have joint pain, my fingers are stiff, I have pain in my knees when I stand up, and we experiment around. Obviously, doesn't appear to be any serious disorder, and we experiment around with certain nutrients and certain diet, and many people find they have a reactive sort of pain, that pain is caused by poor repair, which can be corrected with some anti-inflammatory nutrients, and most of all, eliminating certain foods that may be causing inflammation. So yeah, you want to be careful if it seems to be serious, but I think there's plenty of room to experiment with your diet and nutrients if you say that this doesn't seem to be a terribly threatening kind of situation.
Kate, could I add one more thing?
Sure, yeah.
Since we're talking about going to the doctor and there's different kinds of doctors or practitioners out there, I just wanted to remind people watching that there are those big differences, and that the conventional way of addressing joint pain is analgesics, non-steroidal anti-inflammatories. If it's really severe, maybe a steroid injection, or prednisone for a real chronic condition. Usually pharmaceutical pain relievers, and there's great appeal in that. If you're feeling the pain, you want to get rid of the pain. But the problem is that if that practitioner isn't also looking for the root cause, then even though the pain is suppressed, that problem hangs in there and gradually gets worse over time if it's a progressive arthritic kind of condition, and then you can run into real problems. So I really encourage people to, for acute care, I think any standard physician is going to be fine because they excel at that. Chiropractic can be great for acute onset bony misalignments especially. I would suggest for chronic joint pain to try to seek out someone who works holistically, who's skilled in looking at the body as a unit, everything connected, who will really look for that root cause.
Great
and treat it naturally, and still help with the pain, but look for the cause as well.
Yeah, absolutely. Treating the symptom, as we know, it's never going to eliminate the problem. So yeah, somebody who can dig a little bit deeper, like you said, a chiropractor, an osteopath might be a good choice, or any kind of a holistic practitioner of any kind. So good advice, thanks. So what should we all be doing to prevent joint health issues? Say we don't quite have that achy knee yet, or the hip pain, or the whatever it is, we're feeling pretty good. What are some of the preventative measures we should start taking today? Susan?
Well, obviously in our book we talk about the fact of reducing inflammation in the body, and we use an alkaline diet, what we call the Alkaline for Life diet. We know that excess acids in the body, which can occur because of a little Tilton diet that's not high enough in fruits, vegetables, nuts, and seeds, that you can get a great deal of inflammation from this, and the acid actually collects in the joints and the tissues around the joints. So we say an alkaline diet. We have lots of information on that on our website, betterbones.com. The baseline is 2 cups of vegetables for lunch and dinner, a few servings of fruits, a few servings of nuts, a very nice wholesome diet that eliminates so many of the processed foods and so many of the reactive foods. So our first step is an alkaline diet. Our second step is really to look at, could this situation all be made worse by reactions to certain foods and chemicals? I've seen countless cases. People will say, how can it be? I just cut gluten out of my diet and my pain's gone. I eat one sandwich and my pain comes back. Very interesting, simple elimination diets. A simple try cutting out, gluten, dairy, soy, corn, the colors, additives, those. Just eating a real wholesome diet, free of those types of inflammatory things. I would say one other interesting thing I've seen in my own case, I was beginning to get a little joint pain in my hands, and I realized it was very related to beef. Beef is a product that has a lot of this arachidonic acid, which is very inflammatory, as opposed to fish with the omega-3 fats that are very anti-inflammatory. And if I eat very much beef, more than a serving once or 2 times a month, I'll start to get joint pain, and it's what we call reactive. It's a reactive kind of arthritis situation, reactive inflammation. There's where we start.
Yeah, that it always seems to trace back to that, to what we're eating. If we care to look at it that way, there's a lot we can do. How about you, Mary? What are your best recommendations as far as preventing joint health problems?
I agree with Susan that an alkaline diet is right on. And one reason that it's really helpful is that it's anti-inflammatory. It's usually a plant-based kind of diet, and not, eating lots of antioxidant-rich vegetables, fruits, beans, legumes. I think eating a Mediterranean kind of diet with the fish, the fish oils, the good essential fatty acids, eating less of the sugar and refined carbohydrates, definitely avoiding high fructose corn syrup and trans fats. We talk about these things in every single discussion, I think, because they impact so many different conditions. So, yeah, looking for food sensitivities, which sometimes can take a few weeks of food elimination to really identify it, is right on. The only thing I would add is the importance of the body mechanics. And certainly the Western diet has contributed to the increase in joint pain, or the frequency of joint pain in our society, but the American lifestyle these days certainly doesn't help either. So being sedentary, sitting in a slumped position instead of with a straight spine, that will make the abdominal muscles weaker and contribute to low back pain. Sitting at the computer or behind the wheel of a car with a gooseneck, that can set us up for neck pain. Working with the mouse, repeated motions, like working with the mouse at the computer, especially if it's elevated instead of at our waist level, we're lifting up our arm all the time, and that can cause all kinds of problems in that arm, working into the shoulder and then into the spine. If we stand, this gets away from the Western lifestyle, but most of us have some bad postural habits, whether it's slumping or standing mostly on one leg. And if we stand mostly on one leg, that's going to put a lot of stress on that side. That's going to have reverberations to the other side and up and down the spine. If we have knee problems, it's often because the hip or the ankle have become less mobile, and now the knee is taking the brunt and forced to rotate more than it naturally does. Working with someone, well, actually, even before you work with someone, if you've got a chronic problem, it's, I think, a good idea to work with someone who can look at the whole picture. But there's a lot you can do before that point, such as getting up off the couch, sitting on the edge of your chair at the desk, or work at a standing desk. Stand equally on both feet. Look at the wear and tear on the bottoms of your shoes. See if they're uneven. That might tell you that you've got some asymmetries. Using something like yoga, Pilates, Feldenkrais. I mean, these are all great ways to strengthen and stretch. Increase flexibility, but increase strength. Both of those are lacking in a lot of people today, and that sets us up for all kinds of joint problems. And the only other thing I would add is that we often don't think about fascia, which is a type of connective tissue that is stretchy. It is composed of elastin and collagen, and it kind of functions as a whole body stocking, which covers the entire body and holds, unfortunately, abnormal or unhealthy postures in place, not just healthy ones. So if that's going on, we can stretch, and we might feel good for a few minutes, and then it just bounces right back again, and we don't know why the stretch didn't have a more lasting effect. Well, it might be because the fascia is just locking in that structure. And working with someone who does deep tissue work on the fascia, maybe not to the point of Rolfing, but Rolfing is the same kind of thing, to break up the fascia where it's holding abnormal postures, can really free up the body and then make other kinds of work that we do much more effective.
Okay. So there's a lot we can be doing to prevent. And just going back for a moment to the American lifestyle and kind of our postures, and
Mhm.
here at the office, at the Women's Health Network office, we just recently, within the last few months, transitioned from um, seated stations to sit-stand stations, and we've gotten so much feedback, I think, just within the office about pains, aches and pains that have improved, hip pains and knee pains and things like that. Just having the option to have that better posture, maintain that better posture for longer. So just one of the many, many benefits of standing while working. But yeah, there are probably a lot of things we can all be doing then that are relatively easy. So, so finally, why don't we talk about supports in supplement form? We talked a little bit about the foods we should be avoiding, but are there specific foods we should be eating and specific supplemental nutrients we should be adding in to ensure the length, the longevity, I should say, of our joint health? Um, Susan, what do you recommend?
Well, we spoke about the food already, and each of us in our hearts has heard so many times, the vegetables, the fruits, the nuts, the seeds, the beans. I always say anything you can plant and it'll grow. That's a really good start. And of course, certain fats are very important, like the omega-3 fats, which you can get from fish oils and flax and certain few foods. So we want to actually move more to a really nice whole foods diet that's kind of limited, particularly in red meat, because red meat is very inflammatory. But we need actually enough protein. The fish, chicken, turkey is fine, and the fish is very nice. And if people want to tone their diet, they can start working with the pH, like we teach on betterbones.com. But, the nutrients we haven't touched on. And nutrients, in my practice, we find the nutrients very important. And one nutrient we've used a great deal with remarkable success is quercetin. Quercetin is that compound that gives color to the plants, and it protects the plants from radiation, from molds, from excessive sun exposure, from bacteria. And when we take that substance in our body, we gain those qualities, those high antioxidant qualities of that compound. So we find quercetin works really well. All my arthritis patients we work with quercetin really like it, find it work very well. And then there's many other nutrients, like you need sulfur donors to create that cartilage. And so some people use MSM, for example. That's such a very nice formula. I mean, a very nice part of it. And of course, some of the foods that overlap with medicines are like ginger. There's books written on ginger, all the qualities as an antioxidant, as an anti-inflammatory. So I always encourage either food or ginger and supplements, along with a few other specialized nutrients. But that's where we start out.
Okay, a good start. How about you, Mary? Anything in addition to the foods that Susan mentioned and also the quercetin?
What she mentioned is a great start. I agree with all of those. Vitamin D is a huge one, and I'm sure that Susan would have mentioned that had she remembered because she's, I think, a big proponent of that. Vitamin D is essential for cartilage and collagen. It's essential for bone, as we've known for a long time, but we're learning about its far-reaching effects in the rest of the body. It's antioxidant. It's great for autoimmunity. So something like rheumatoid arthritis or lupus, the joint pain that goes along with that, vitamin D can make a big difference. It's anti-inflammatory. Other anti-inflammatory herbs besides ginger, a great one is curcumin, which is in curry. So just like Susan said, you can add ginger to your meals. You can do the same thing with curry. Just eat a lot of. Curry is so yummy. Most people like it, and you can prepare it in so many different ways. But if you've got a chronic joint problem, you probably also want to consider taking curcumin as a supplement so that you can get in a higher amount. Right. When you take in curcumin, it doesn't absorb very well. So the curcumin phytosome form of curcumin is something that's been researched really well and found to absorb about 20 times better than other forms of oral curcumin, supplemental curcumin. So keep that in mind. Boswellia, also called Indian frankincense, that's excellent for inflammation. And then just minerals that are great for the bones, also great for the collagen, the cartilage, those tissues in the joint would be magnesium, manganese, zinc, copper, also vitamin C, the B vitamins. I mean, if you're taking a really good, solid multivitamin mineral formula, you're going to be getting most of those in. MSM, like Susan mentioned, is great. Another sulfur compounds that you might consider would be chondroitin sulfate, glucosamine sulfate. So those are the biggies. The herbs, I think, really go a long way in keeping the inflammation down.
Yeah, and we don't want to forget the omega-3 fats, which are so very important in reducing inflammation. And we're experimenting here with this green lip mussel, which is a form of New Zealand mussel that has some nice omega-3 fats and other inflammatory properties. So there's many different nutrients you can put together. We're thinking about what's the best combination. But we always have that broad net of all those basic nutrients and focusing on, particularly on the things that might be especially anti-inflammatory.
Okay. Excellent. Well, it sounds like we're covering all the bases there between the foods and the supplements. So, well, those are all the questions that I had for you today, Mary and Susan. And everybody, thank you so much for being here. You can check back on our website. We've got a lot of really interesting information about joint health that's going to be coming out, as well as some joint health support products for you to take a look at. But always, if you want that information, check back to womenshealthnetwork.com, and you can also check out additional hangouts on our YouTube channel. So until next time, Mary and Susan, thank you so much for being here.
Thank you.
Bye-bye, everyone.
Bye.
Susan.